is jurisdictional designation important? Well, put in base terms, jurisdictional designation is going to determine, in the large case, the amount of time and investment required to get the combination product to market. So the jurisdictional designation is going to determine the type of pre-market review your product will undergo, be it a PMA for a device, an NDA or a new drug application for a drug that's been assigned to the CDER, and a biological license application for a biologic. The user fees and clinical trial requirements can vary greatly depending on the designation. For example, a new drug application typically requires 60 clinical trials looking at issues such as pharmacokinetics, drug interactions, and toxicity, whereas a PMA for a device typically requires only 2 to 3 clinical studies, so big differences there. The review times can also depend on the jurisdictional designation. A relatively straightforward device 510K would require approximately 30 days review in the best situation, whereas an NDA, if you have drug as the lead center, would typically take 6 to 10 months. So, of course, this can factor into the development time as well. Obviously, your firm's familiarity with the various regulations is probably going to impact speed to market, and these can vary greatly. Probably in this room, we have a lot of familiarity with device regulations, but moving to drugs and biologics could obviously represent some new challenges and hurdles. Downstream considerations such as manufacturing and post-market surveillance are also impacted, and I'll discuss those later in the presentation. So now turning back to the regulatory pathway flow diagram, ideally you should be maintaining an open and productive dialogue with the